You, Urs, and nice to see so many of you in here. As was just alluded to by Urs, it's true that when OHBM was initiated, it was actually separated from the brain PET at the brain meetings, and that's where most of us who have been doing PET for all those years, we have gone along with a few other meetings, but I'm really pleased to be back here. There's a lot of great science going on. And I think now it's time to think about multimodality again. So how come that PET and MRI have been separated to such an extent? I think it probably has to do with the fact that most MRI scanners are run by radiologists, whereas PET is more run by nuclear physicians. But now with the recent adventure of having a combined hybrid scanner, I think we'll see a lot of new opportunities and see how people can also merge and do that. And this is certainly what we are trying to do in my lab. First I'm going to show you an overview of these different methodologies. So PET is excellent for showing receptor activation, neurotransmission, and how neurotransmitters can be released. Then that will then activate neurons, which elicits energy consumption and metabolism, and that again acts on the blood vessels to generate the hemodynamic responses we see with task-based MRI. So there are different modalities that are suited for imaging these different parts of the brain, and by combining these different modalities, that enables us to really truly get a better overall picture of what's going on. So it's not like the PET people haven't used MRI before. It's been used all the time, in fact, to localize anatomically where the emission tomography images what's going on in the different regions. And this is an example of the serotonergic system measured in vivo in healthy people. It's an atlas of the different receptors that can be imaged at this stage. It is a surface-based registration and quantification. So you basically project the time activity curves to the surface, and that enables you to have a much better quantification of these receptors. Another area where people have used hybrid PET MRI, and I'm going to show you 4 examples now, is to investigate resting state fMRI signals at the same time as metabolism. And in this example, they ask people to have open eyes and closed eyes, and to do finger tapping. Now, we have to recall that with PET, we need a certain amount of time because the temporal resolution is to no extent the same as with PET. But by using a special steady-state method introduced by the Martinez Center a few years ago, where you have a constant infusion of FDG, you can intersperse this constant infusion with different challenges, and this is what, and you can see at the upper panel at the right shows you activation in response to visual stimuli as compared to a frontal reference region. And if you subtract the 2 signals in the lower right panel, you can see how the metabolism can be estimated based on those slopes. And so in getting back to the left study, what they did here was to identify areas with increased metabolic load, place the seed, in this case in the left motor region, or as shown in the lower panel in the visual cortex. And then they looked at the changes in connectivity and could identify which areas would be downregulated in response to the metabolic drive. This was the first example, but probably another even more important area where we can see that hybrid PET is going right now is by pharmacological neuroimaging. And I don't need to talk at length in this audience about the MRI aspects. I just want to mention for the PET that here you see in the right panel, middle, a very early observation made back in the 90s by the Karolinska group, where they showed very convincingly that in order to treat patients with schizophrenia appropriately, they needed to target a specific occupancy of the dopamine D2 receptors. If they went below a certain occupancy rate, they would have no efficacy. If they went beyond that, they would start to have extrapyramidal side effects. So getting that occupancy range right has been a main goal for pharmaceutical industry ever since, and that's why they need to start very early on to identify appropriate radioligands for measuring the occupancy. So with PET, you can look at the drug penetration and kinetics. You can identify whether it engages with the target you're interested in. You can identify pharmacodynamic effects, occupancy, as I said, and also neurotransmitter release. And I'll show you some examples of how this has been done. So this is a study where we treated healthy people with selective serotonin reuptake inhibitors, which is used to treat major depression. We used fluoxetine, double-blind randomized study, where we conducted separately PET and MRI imaging before and after those 3 weeks of intervention. And the PET radioligand we used was a radioligand that binds to the 5-HT4 receptors. And we had already some idea from preclinical studies and genetic studies in humans that the 5-HT4 receptor is inversely related to serotonin levels in the brain. So sure enough, in this study, we could see that in the fluoxetine group, there was a downregulation of 5-HT4 receptors compared to baseline, whereas the placebo group didn't change much. But you can see there is still some variation, maybe because serotonin levels can drift over time in healthy volunteers as well. That doesn't seem too unlikely. Now, we also did a task-based fMRI presenting emotional pictures and expecting, because this has been described in the literature, and we were expecting to see amygdala reactivity decrease in those people who had been treated with fluoxetine. But to our surprise, we didn't see any difference. You see the left and the right amygdala reactivity in the individual subjects. But then when we combined the fMRI response with the change in 5-HT4 receptor binding, we saw that the expected association was there, but we just had to take into account how the serotonin levels had changed between the two situations, and that applied for both amygdala. So this means, in this first example, that neuroimaging of the 5-HT4 receptor indexes these long-term, which is 3 weeks. We know from other studies that it doesn't induce any short-term changes in serotonin levels in the brain, and also that we could see that these serotonin levels are dynamically regulated, and only when we take those dynamic changes into account, you can make proper inferences about the functional fMRI data. So the next example I'll show you is a non-human primate study done in collaboration with the Martinez Center in Boston, where we used their hybrid scanner, PET-MRI, to investigate the 5-HT1B receptor. This is a receptor that is also the target for triptans for migraine treatment. The structure of the 5-HT1B is quite well known. The localization of the receptor is predominantly in occipital cortex, but also in other brain areas. And the question we were asking here, Hanne Hansen, the postdoc, and myself, was how is the fMRI signal related to 5-HT1B receptor occupancy? And the setup you can see in the middle. We had a bolus infusion of the radiotracer. We did dynamic fMRI acquisition to measure CBV changes. And we also had a dynamic PET acquisition. And then in the middle of the scan, we did the challenge, which was either to give a dose of the partial agonist compound AC, or to give antagonists, in this case sumatriptan or GR. And what happened with the agonist is shown here on the left side. The upper panel shows the PET response, and you can see that the agonist induced some occupancy. The lower time activity curve is the reference curve from cerebellum, where we know there are no 5-HT4 receptors. And you can see we have a steady state level because of the constant infusion. But the moment we give AC, we have a declining time activity curve. The lower panel shows the dose response of the fMRI signal, and we see an initial negative response followed by a larger, longer-lasting positive response, again dose-respondent. And when we look at the antagonist, we can induce similarly very high occupancy, almost 80% of occupancy. But in spite of that, we don't see any fMRI signal, meaning that the agonist induces the hemodynamic response. And there is a very nice dose relation between the occupancy on one hand and the dose and the fMRI signal, both for the negative and the positive response. So this example shows you that these 5-HT1B receptor compounds that have pharmacologically distinct characteristics, i.e. either an agonist or an antagonist, they elicit specific hemodynamic response profiles. I don't have time to go into what we believe is happening, but this is the conclusion that we can make on this. And then the final example is a study published by Christine Sande from the Martinez Center. And this was one of the first studies to be published with hybrid scanners. Again, this was also in non-human primates. And the question she was asking is, how is the fMRI signal related to dopamine 2 receptor occupancy? So the setup was the same as I just showed before, except that now she would give increasing doses of cold raclopride. Raclopride is an antagonist at the D2 receptor site. So we would expect to see an increasing blocking. This is the design. So here we varied the doses together with the injection of the radioactive material. And here is what we found. So at the upper panel, you see the PET signal. There is a nice signal in the D2 receptor areas. And as expected, nothing is going on with the fMRI. These are tracer doses, so we don't expect to see any pharmacological effects here. And we know that the basal dopamine occupancy is 20%, so the endogenous dopamine levels make sure that D2 receptors have about 20% of the receptors occupied with dopamine. And this means that when we give the antagonist raclopride, it binds to the available receptors, and you have a large PET signal. Now, what happened when we gave a high mass dose of cold raclopride was that the signal was blocked completely in the D2 receptors, whereas we saw a positive CBV signal in the same areas. And this is because in this situation, the antagonist displaces not only the radioligand, but also the endogenous dopamine. So now all of a sudden you have altered the tonic levels of dopamine, which is giving rise to the MRI signal. So this example shows you that these relative fMRI measurements can reflect basal D2-3 dopamine receptor occupancy levels. And this could have impact for instance, schizophrenia, where we know that the dopamine levels are different. And it also provides a basis for models that relate these occupancies to the hemodynamic changes, at least in the basal ganglia where the D2 receptors are most prevalent. So to give an overall conclusion, I've got 10 seconds left for that. I don't need to read it all loud, but I hope that I have convinced you that these hybrid scanners are very useful. They can assess metabolic activity and blood flow, but they are also important for development of novel drug treatments to ensure target engagement and also to determine receptor occupancy. And I envision that in some cases at least, fMRI studies could replace PET studies. And so that was all for now. Thank you for your attention.